Okay, good. Can you please raise your left leg up for me?
Perfect.
Dr. Murali Kolikonda is demonstrating how he interacts with patients using telehealth. He is a vascular neurologist and the system's medical director of telestroke and teleneurology at Baptist Health Medical Group located in Kentucky.
The Lexington, which is a comprehensive stroke center, which kind of motivated me to come here to work with my multidisciplinary stroke team.
Based on our exam, then we're going to decide.
We have two sites, which is Richmond and Carbon, which are local hospitals, and they feed into our Lexington site, which is a comprehensive stroke center.
Dr. Kolikonda says telestroke and teleneurology programs, like the one run out of Baptist Health Lexington, are lifelines for many people living outside the city limits.
We don't have any neurologists in our regional sites, and there is no stroke specialist. Important thing is it is going to have an immediate assessment in emergency departments, bringing the neurologist or a stroke specialist into the emergency departments via a monitor on the screen, and we do the immediate assessments, evaluations.
That ability to respond immediately is crucial because, according to the doctor, early diagnosis and treatment is the key to surviving a stroke.
And this happens so fast, and this is recognizing the symptoms is one thing, and activating the necessary appropriate teams is one big thing. And patient could have been paralyzed, patient could have been having high morbidity, and even patient could have died. And it really gives an immense satisfaction as a physician for me taking care of those patients in regional facilities where there is no neurology or stroke expertise.
The doctor demonstrated for us earlier how some of that is done, but there's another side to the program that's critical: the ability for the larger medical team to do assessments using a simple app on their phones.
We have this imaging apps on our phones where electronically these images are being transferred. At any point of time, there are 3 physicians who are looking at the scans. There is a neurointervention, neurosurgeon, and a vascular neurologist is looking at the scans and making decisions on real time.
The doctor says the technology is working and saving lives.
I have seen a patient the other day where we have seen a patient at Carbon who was having this complete left-sided weakness, and he was not able to move and not able to talk, and he got this clot-busting medication, and within 23 minutes, which is way below the national average, that we treated that patient, and we brought the patient to the main hospital. We did a brain cath where we removed the clot out within less than 40 minutes, and the person went home the next day.
He does point out, however, that these types of programs require strong broadband connections, and good internet access is something Baptist Health considers as leadership looks to bring the program into new rural locations and clinics across Kentucky.
It is vital, especially in this telestroke system, because you're treating patients on real time and you're making decisions on real time, looking at the scans on your phone from the mobile apps. So connectivity is a very crucial aspect of telestroke and teleneurology.
The doctor says the program was able to grow in part because of the lifting of some regulations that previously limited telehealth.
Pandemic has expanded, and it has really provided some privileges, in terms of who can do telestroke, and it has really helped us. So there are so many reasons that some people have adopted in a way that we never imagined. And right now, with the current scenario, I see that this is definitely not going anywhere, and I see more and more physicians adopting to this.
He adds that the pandemic also created a new and unexpected response to signs of stroke, a fear to come to the hospital.
They were sitting at home until it got worse. They were coming to the hospital. By the time all the early stroke treatment windows, we are out of all the treatment options at that time.
But he wants everyone to know that if there is a hospital near you and you don't have to rely on telehealth, the staff is prepared and the building sanitized for COVID-19. It's why Dr. Kolikonda asked us to share some parting advice.
And any signs of stroke, I really want people to pick up the phone, call 911, and come to the hospital.